Hello, in this video, we will discuss whether water restriction is necessary for heart failure patients. I am a Japanese cardiologist. In this channel, I tell you about medicine from the basics. Sorry, but I am not good at English. And please note that this is the content of medical treatment in Japan. Ushi-Sensei is Japanese, and it means cow doctor in English. Please subscribe my channel. Heart failure is defined as a clinical syndrome consisting of dyspnea, malaise, swelling, and decreased exercise capacity due to the loss of compensation for cardiac pumping function due to structural and functional abnormalities of the heart. It is important to note that heart failure is a syndrome, not a disease. When treating patients with heart failure, it is important to distinguish the causes of heart failure and the precipitating factors. Precipitating factors of heart failure include the following: forgot medicine, arrhythmia, anemia, ischemia, infection, lifestyle, including insufficient water restriction, upregulator, rheumatic, embolism. From these initials alphabet, we remember them as failure in Japan. In my previous video, I discussed whether salt restriction is necessary in patients with heart failure. In conclusion, there is no clear evidence for salt restriction, but appropriate salt intake is necessary for heart failure patients. The severity of salt restriction should be determined on an individual case. On the other hand, is water restriction really necessary for heart failure patients? Japanese guidelines warn that excessive intake is a risk and suggest limiting water intake in patients with severe heart failure. In other words, limit water intake in patients with non-severe heart failure. Elderly patients are less likely to complain of thirst, so we should note dehydration when limiting drinking water to the elderly. If a patient has heart failure complicated by hyponatremia, it is better to introduce tolvaptan than to restrict drinking water. Tolvaptan is an oral drug that inhibits arginine vasopressin type 2 receptors (AVP). In Japan, it is indicated for patients with heart failure who are resistant to other diuretics or who are with hyponatremia. AVP antagonists suppress hyponatremia and are beneficial in the treatment of patients with intractable. After tolvaptan is introduced, drinking water should not be restricted because of the risk of hyponatremia. In my experience, I feel that cases of heart failure exacerbated by excessive drinking are rare. There are few cases of heart failure exacerbated by excessive consumption of sports drinks. I have not had experience with heart failure improving simply by restricting drinking water. When giving lifestyle guidance, the important thing is to remember to take medications, I think. Next, it is more important to restrict salt content than to restrict drinking water. I have a feeling that water restriction is unnecessary in heart failure patients. Actual therapy in my idea, I do not believe that routine water restriction is necessary for heart failure patients. There are a lot of things to do in the treatment of heart failure. For example, we should instruct the patient not to forget to take the medication. Salt restriction is more important than water restriction. Exercise therapy is important in the treatment of heart failure, regardless of left ventricular systolic function. Percutaneous coronary angioplasty is also effective if ischemic heart disease is present, and catheter ablation is effective if atrial fibrillation is present. On the other hand, I think Drinking counts are important in the early stages of hospitalization for heart failure. Urine output is very important in the initial treatment of acute heart failure. In addition, the balance between daily water intake and output is especially important until heart failure stabilizes. Daily water output should be much more than daily water intake. However, the situation is different in the most very severe cases of heart failure. If there is nothing else to do and the patient has repeated exacerbations of heart failure, then drinking water should be restricted. It makes sense to limit the amount of water from 500 to 1000 milliliters per day, at least if the patient with very severe heart failure drink water more than 1,500 milliliters per day. They should limit their drinking somewhat. In summary, there is no clear evidence for salt restriction, but also for water restriction. Excessive water intake can be one of precipitating factors of heart failure, so especially in patients with severe heart failure, restriction water intake is reasonable, but there is no significant benefit unless excessive drinking water is observed. In conclusion, I do not believe that the routine drinking restrictions are necessary. Thank you for your visiting and watching my movie. See you.